Hello everybody, Assalamu alaikum, good afternoon, good evening, or even good night, depending on your time zone. Well, let's get things going with station 4 today. And for station 4, I think that everybody is almost agrees on communicable disease, dealing with someone with a communicable disease. Anyone who has an exam soon and would like to take the case?
Yes, Dr. Muhammad.
I know this voice. دكتور مرفدي. ازيك يا دكتور مرفدي؟
الله يحفظك. تمام.
Okay, so let's get things going. We have a 27 years old gentleman, Mr. Stewart, who was referred to you by the GB for 2 weeks history of coughing and weight loss. Further assessment done by the consultant, including chest X-ray, CT of the chest, and acid saline testing, has revealed the diagnosis of an open TB, for which the consultant suggested admission to start the patient on the appropriate treatments. Mr. Stewart remains worried about his condition, and he wishes to speak to you. You are the senior house officer in the chest department, and your task is to meet the gentleman to update him as regards the unfortunate diagnosis, the management plan, and to address any concerns he may have. So this is a typical case of communicable disease. Again, if someone can write down the scenario in the chat, it would be awesome to help others. So we have a 27 years old gentleman who was referred to you by the GB for 2 months history of having weight loss along with a cough, which was diagnosed by the consultant after fully investigating the patient with a chest X-ray, CT chest, and testing for the saline in his sputum of having an open TB, for which an admission was suggested to start him on the proper treatment. The gentleman remains concerned, worried about his case, and he wishes to speak to you. You are the senior house officer in the chest department, aka you are the doorman in the chest department, and your task is to meet the gentleman to update him as regards the unfortunate diagnosis, his management plan, and to address any concern he may have. This is as regards the scenario till Dr. Marfadi prepares his case. We will discuss how or the general principles of station 4. As usual, as every time, we always start by outlining the paper properly. So we will have the name of the patient on top, then I'm going to write down my task. Following that, I'm going to write down on the history points that I need to configure or to get from this patient during the discussion. Note that in station 4, it is mentioned clearly in your scenario, in every scenario, that clinical history or history is inappropriate. You should not take any history from the patient. And by that, they mean clinical history. But items of the history that you have to, it's not an option. You have to get in every case are the social history, past history, and medication history. As a general rule, as long as the patient is still alive. Then the family history only if the condition is congenital. And the main reason for doing that is to offer him help. Note that offering help in any case is equal to 25% of the mark, if not more, depending on the case, applicable for station 2, 4, and 5. Then comes the approach of station 4. Simply speaking, it is composed of 3 main components. An introduction, and this is a fixed way of getting to start your conversation. 6 points or 6 steps fixed, and you can find that in the PDF shared in the all groups. Then we have a stem, depending on the case in hand. Obviously here, this is a communicable disease. And at the very end, we have a closure, and the closure is essentially 7 steps, also standard for such a case in the PDF. You can find the PDF on Telegram group, and you can find all that cases, all this case and other cases also in my book if you are interested. Regarding station 4, to agree from the very beginning, especially for the newcomers, that my job or my task in any scenario is going to be a doorman. What does that mean? It means essentially that I am always following the building owner. The building owner is my boss. He is the consultant in the scenario, and he is the same person as your examiner. All of them are the same person. You do not want to provoke your consultant and hence your examiner. So as a doorman, I will always support my consultant's decision regarding the treatment. I'm not going to offer any investigations, whatever kind of treatment, unless decided by him. Otherwise, I will refer to the MDT. So no investigations or treatment unless decided by this guy. Second point, as a doorman, I'm not going to give any time frames, simply because I do not know. So, moving on, as a doorman, I'm not going to give any promises. And finally, as a doorman, I'm not going to say yes or no. Most of the time, I will use diplomatic answers. What are the diplomatic answers? This is to play the game of communication. Playing the game of communication, very easy, standard, equals 60% of any communication case. And that is always to show the appreciation or the sympathy for sharing that question or showing sympathy regarding a bad condition. Then the negative idea is to be honest with your patients. Then the positive idea is to offer him help and support, always maintaining the word follow up. Follow up equals the follow mark. This is the general principle of station 4. If you master those simple steps, things should be very easy, straightforward. Back to the case, we have a young gentleman who is 27 years of age. End of story. To make the story short, long story short, he was diagnosed of having an open TB. The gentleman is worried about his condition and he wishes to speak to you. You are the senior house officer in the chest department, and your task is to meet the gentleman to update him as regards the unfortunate diagnosis, his management plan, and to address any concern he may have. Dr. Marfadi, your paper should be ready by now. Are you ready?
Yes, I'm ready.
Okay, let me set the timer first. And I want you to get this case perfectly, otherwise I will kill your headphones. حاجة أولع لك وسماعتك وسماعة الدكتور علي.
إن شاء الله لا.
Okay.
إن شاء الله.
Timer is on. Go.
Hello, I am Dr. Marfadi, senior house officer in chest department.
الله يولع سماعة الدكتور فهد بالمرة كمان على فكرة. اتفضل يا باشا.
I am talking to Mr. Stewart, 27 years old.
That's right.
Nice to meet you.
Likewise.
We are here today to discuss about your condition. Is it okay with you?
Yes, please.
Okay. Can you tell me what's your how much you know about your condition?
Well, I do not want anyone to attend this meeting with us, and I have been very poorly over the past few weeks. I was coughing up a lot of phlegm continuously, and I have been losing weight and had no appetite for food. I have seen the GP repeatedly, and on the last occasion, he did refer me to the consultants. I underwent a lot of investigations, some blood testing, some imaging, and they have also taken a sample from my phlegm, and I'm so worried about the results.
So can you tell me what's your expectation, please?
I'm afraid this can be something like the coronavirus.
I appreciate your concern. As you mentioned, we did already for you. You came last few days. We did for you blood test and imaging. The result show us not we hope.
What do you mean?
It show you have a condition called pulmonary tuberculosis. You heard about it?
No. Is that serious?
I appreciate your concern. It's serious if leave without treatment. It's like bug infection that I will draw for him the lung. There is bug infection affected his lung, affected your lung, and this is considered as a communicable disease. That means it's transmitted through airborne. That means maybe transmitted from person to other person through coughing or sneezing.
Oh my God. Am I going to die?
I appreciate your concern, Mr. Stewart. This disease is controllable. We can control the disease if treated well. So with regular follow-up and give proper treatment, it will be under control.
So is it curable or not?
It's curable. Just I appreciate your concern. It's curable disease, but as I mentioned for you, it's needed to become under observation, and we need to admit you. And
Admit me?
we need.
Why?
Yeah. As I mentioned for you, the result of your sputum and imaging and blood tests show you have this phlegm. There is pulmonary tuberculosis. As I told you, is infection. There is bug infection in your lung, and this is considered as communicable disease. So this is needed for admission, and other next step also to isolate you.
Oh my God. What do you mean isolate me? I will not be able to contact anyone?
I appreciate your concern, Mr. Stewart. As I told you, this is communicable disease. So need to protect you and to protect the other. So we need to isolate you in the special room. That there is some negative pressure inside the room. That's meaning it will be free from any infected air to protect you and protect the other.
And for how long you'll be in that isolation?
I appreciate your concern. This is after we admit you and isolate you.
We will try to change now. Instead of getting all appreciation, I can only imagine how stressful that is for you. I'm sorry regarding the bad news. So we will start to make things. Okay, carry on.
Okay. I can imagine how much this is terrible for you, Mr. Stewart. So we need to, as I told you, we need to follow some, we can give you some, we can admit you and you can receive some medication from our medical team, and we can keep you in the regular follow-up till we can find the sputum free. After that, we can updating you the investigation, and we will decide later about your for your discharge.
And what about this treatment? What kind of treatment is that?
This treatment it will be considered later. It will be decided by multidisciplinary team like chest doctors and infection doctors. They will can arrange and they will decide the plan for your management.
And how long does it usually take to get rid of this disease? You told me it is curable.
It's curable. So as I told you, we will keep you under regular follow-up, and we can again do for you the flame. If it's negative, that's meaning you are not, you will not do infection for the other. So we can discharge you safely. That's the time.
Thank you. But there is no time frame for that. From your experience, what do you think the time frame will be? For how long will I be staying in the hospital?
I appreciate your concern. It's, as I told you, is under regular follow-up, and we see improve your condition. After that, the multidisciplinary team, they will decide for your condition.
Okay, thank you.
And we will write according to your condition. We need to write some notification to local health authority to know about your condition.
Why?
These should be to clarify how many cases we have here and how they will treatment it properly.
You are going to give me the treatments.
Yeah, and also
So,
we can.
Why
Right,
would you
some-
breach my confidentiality to write about my case to someone else?
I appreciate your concern, Mr. Stewart. This is not breaking confidentiality. This is just to take more precaution and to prevent transmission of your condition to others. And we
Well, you told me that I'm going to be isolated in this hospital and I'll be receiving treatment here and I'm going to be isolated. Why do you have to tell the health authority about my condition? I do not want anyone to know about my condition. If they find out about my condition at work, I will be fired. I do not want anyone to know about my condition, please.
I appreciate what your concern, Mr. Stewart. As I mentioned to you, this is not breaking your confidentiality, and nobody will know. This is just for local health authority. That's they can take more precaution
Or what kind of precautions?
to
Contact
prevent transmission.
contact tracing.
Contact tracing. We need also to
Oh my
do
God.
the
Do you want to tell me that you are going to tell everyone about my condition while I'm tracing the case?
just we need to do some screening for your like kids or your family that you have contact with them.
But
So we
if
can.
you do that, they will have to know about my condition, and this is a breach of my confidentiality. Now everybody is going to know about my condition, and they will end up isolated. Nobody's want to even go and visit me in the hospital.
As I mentioned, I can imagine how much this trouble for you. So just we need to do screening because we can to prevent the other and to know their condition. So we can help them and we can prevent the disease to develop.
Doctor, with all due respect, I think that you are a junior doctor and you have no idea what you're dealing with here. A lot of things are unsafe, and I cannot have that risk. So I would rather hear that from your consultant. Where is your consultant?
I appreciate your concern. My consultant now he's aware about your condition, and he has now busy. He has some emergency cases and other cases he's dealing with it. So he will tell you exactly what I'm telling you.
I would like
Are
to
you
meet
follow me,
him,
Mr.
please.
Stewart? Are you follow me?
Yes, I'm following you, and I would like to meet him, please.
Okay, it's you're right. We can arrange other meeting as soon as possible, so you can get chance to discuss with him and you can tell him your concern.
Thank you.
you tell me what's your job?
I am a receptionist in a hotel.
Okay, for that we can talk to occupational care health worker to arrange for your job, because you in this condition you are risky for the other. So we can arrange with this to discuss about this your point.
Thank you.
Okay. Can you tell me, do you drink alcohol?
No.
You smoke?
Yes.
How much cigarette and for how long?
How many cigarettes per day? 20 cigarettes per day for the past 5 years.
If you never mind, I will advise you to motion cessation clinic. That's, as you know, the smoking is bad habits on your condition.
So I strongly advise you to stop
smoking. If you never mind, I will refer.
If you need help, I will refer you to the smoking cessation clinic. Well, this is one of my concerns. If I'm going to be hospitalized, isolated in a room, I will need to smoke. Am I allowed to smoke in the hospital, inside the hospital?
I am sorry to tell you, it's not allowed, especially in your condition.
So I cannot be admitted. I refuse the admission, because admitting me right now and stopping smoking all of a sudden is something that I cannot handle. So I will not be admitted.
Yeah, I am really sorry about what's your concern about smoking, but as I told you, your condition, if leads without treatment, it will be life-threatening about your condition, about your life. So I am advised strongly to admit you, and if you to stop your smoking.
I will think about quitting smoking, but for the time being, I cannot stop smoking right away.
I appreciate your concern, and I'm sorry I can't refer you to cessation clinic. Maybe they are in good position. They are in good position to talk about this point, if you have desire.
Thank you.
Do you have any medication? You are using any medication?
Show me your medication list. I'm not receiving any.
No. Okay. Do you have any other members they are suffering like what you are?
No.
Okay. So can you tell me do you have any other concern? Hello? Hello?
Sorry for the interruption. Carry on.
Okay. Okay. Can you tell me, do you have any other concern?
Well, yes. About this treatments, you told me that I'm going to get treated for that. What kind of treatment is that? Going to be a tablet or injection or what? Why cannot I take it at home?
I appreciate your concern. As I told you, this should be because you have positive flame test. So firstly, you need to admit here, and you should be receive treatment. There is management plan. It will be considered by infection and chest doctors. After your follow-up and regular and
2 minutes remaining.
Okay. After the phlegm is negative, we can discharge you home.
Thank you.
Do you have any other concern?
No.
Okay. Leaflet and website you can read about your condition.
يا راجل. Closure, Dr. Marfadi.
Yeah. Okay. Can you tell me how much you get from our discussion today?
Closure, Dr. Marfadi. 1 is concern. I do not have any further concerns. 2.
Okay. As we mentioned, you have conditions called tuberculosis, and is a communicable disease, and is spread by airborne. So as I told you, you need for admission and to isolate you, and need to do some notification, contact tracing. Do you have any other concern?
No.
Okay. So I will give you some website and
Look at the screen. Concern 1, checked. Summarize, done. Concern, checked. Next step.
Can you tell me how much?
Hello?
Yes. Can you tell me how much you get from our discussion today?
That I have a condition that can be transmitted to others easily and I need to be admitted in the hospital. And I will discuss that with your consultant as regards the treatment plan and for how long I'll be staying in the hospital or not.
Okay. Do you have any other questions?
No?
About leaflet and website and also contact number, you can call me anytime if you want to ask anything about your condition.
Thank you, I appreciate it.
Do you have any other concern?
No, thank you.
Thank you.
Let's fight. تعالى لي.
Allah. تولي يا سماعة.
Okay, so to start with, overall, very well done. But some few points that we need to consider in order to make things perfect. Whatever is applied to this case can be applied to, so open TB is essentially the same as meningococcal meningitis, and expect recently to have a corona discussion. All of them share one point, and this is the most important thing here, that all of them are airborne transmitted, like you have mentioned. So let's get things in order step by step. First, what is the medical issue in this scenario?
Medical is 27 years. Hello.
Okay.
Of cough.
Okay, so whenever he's asking about the medical issue, you will start to mention the story or to tell the story in your own words. But we always begin with the number in order to be organized and to get the proper impression. Perfect. Moving on. What are the ethical issues in this scenario?
Autonomy and efficiency and maleficence, and
I again will ask you the same question and I want you to give me the proper answer. What are the ethical issues? Each that term
autonomy.
Definition.
The patient has right to know diagnosis and refuse to accept the medication. Beneficence, to do the good for the patient. Non-maleficence, avoid harm the patient. And justice, to treat patient regardless of the race, age, and sex and religion.
Perfect. Do you think that this gentleman is going to be accepting the admission in the hospital or not?
This patient, he is going to accept the admission.
This patient was arguing all the time regarding his admission to the hospital, so most likely he is going to refuse the hospital admission. Does he have the right to be admitted or to refuse the admission or not? In other words, if this gentleman disagrees with your decision, if your patient disagrees with your decision that he needs to be admitted and he wants to go home, will you allow him to go home?
Sorry, doctor?
Will you allow this patient to go home if he doesn't want to be staying in the hospital or to be admitted?
No, I will ask him why. If she is refusing, I will ask for my consultant help. If no, I can discuss later with the legal team.
Did you tell him anything regarding the severity of the condition or any possible complications that he may suffer from if he doesn't stay in the hospital and comply with the treatment?
I told him it will be life-threatening condition for him. And there is many complications will happen.
Okay. Anything else in the history you would like to ask this patient about?
About traveling.
Anything else? The basic stuff, ya Marfadi. What does he do for living? Whom is he living with? Does your symptom affect your job and daily activity? This is the proper 2-in-1 question in order to offer help. You did offer me the occupational health officer because I was worried that I'm going to be terminated. But you didn't ask me about the implication of this problem on my life and my job. Please never forget to offer help. Is there anything else in the history you would like to ask about? This is a case of an open TB in a young male patient. Would you like to check for something else? Or would you like to test him for something else? What is the twin of the TB?
TB family package, you know. God.
Okay, so the family package is TB, cancer, lymphoma, and
HIV.
HIV. Do you think that telling this patient about HIV testing would be appropriate as a part of the management plan here or not?
Maybe he will get angry and he will.
This is not the question. The question is it part of the treatment or not? It is part of the treatment. يبقى ما سجلتش عليه ليه؟ ليه؟ So why didn't you ask about it?
You mean family history, you mean?
Not the family history, not the family package. You need to identify the risk factors for HIV in this case. Why HIV? Because most patients, there is a very common association between TB infections and HIV. Whenever someone is diagnosed of TB, automatically is for HIV testing. Is a candidate to have HIV.
Sorry, doctor. Is this should be
coming at the discussion? Let's finish the discussion, Dr. Marfadi, first. Then we will get to the questions. What are the legal issues, Dr. Marfadi?
A legal issue here is isolation.
How would you manage? How would you manage a communicable disease?
Admission, isolation, notification, contact tracing.
Perfect. Admission, and you have told him why he should be admitted. But the admission is not only for the sake of not infecting others, but it is also for the patient himself not to catch any other infection that can be very dangerous in the context of having TB. So there are 4 steps of management. Admission, and this is a win-win situation for the patient and for the public. Then isolation. Why isolation? Because this is a very easily transmitted infection among people just by coughing, sneezing, or touching. Never forget that. By touching objects contaminated with this infection. Then notification. And the notification is done essentially for the next step, which is the contact tracing. Who will be doing the contact tracing, Dr. Marfadi?
It's like family members.
Who will be doing the contact tracing?
By infection control.
Infection control, which is the health authority. And that's why they need to be notified in order to take the necessary precautions to contaminate not or to contain this infection and to prevent it from being transmitted to others, and to test anyone who came in close contact with the patient in order to give them a proper prophylaxis after testing. Agree?
Yes.
So, is notification of the condition is a breach of confidentiality?
No, not breach of confidentiality.
No, it's not a breach of confidentiality. I agree. So this patient was concerned about his colleagues knowing about his condition, and he doesn't want anyone to know about it. Does the local health authority or the higher health authority or the infection control team will breach the confidentiality of the patient? No. And this is the answer that the patient was waiting for. So overall, well done, Dr. Marfadi, but let's focus on the approach here in order to get all the points done properly. So I will start with an introduction. And the introduction is going to be 6 points, as usual. Then I'm going to break the bad news. A warning shot, followed by silence, break the bad news, then silence and willing to offer help. Then I'm going to give him the definition of the condition, which is an infection with a superbug or a strong type of bug to his lungs. Let me draw you a drawing in order to get the full mark in clinical communication. And unfortunately, the symptoms that you have been suffering from, which is the clinical picture, which you enumerated, the coughing and the loss of weight, And unfortunately, this disease, if left without treatments, can end up with complications which are potentially life-threatening. And this has to be very clear during the discussion from the very beginning how serious the condition is, because I will need it later on when he refuses the treatment. And always expect a refusal. Agree? Agree. Then after that, I will give him a treatment. But before I give, I always take. So I will take the history. This is the missing piece in your paper. This is what you did not write down, and that's why you did lose it in the exam. Imagine yourself now sitting at your desk. You are completely relaxed, and you are forgetting points by not writing them down. So it is very likely in the exam to forget them as well. So please write them down to make sure that you are minimizing the chance for error. So I will start by the patient's job. Whom is he living with? Then I will ask about the implication of both in order to offer him help. Smoking, alcohol. We will cover the questions at the very end. Smoking, alcohol. What else needs to be tested here or checked for here in this case? The possibility of having HIV. I have to mention HIV one way or the other in front of the examiner. How to do that? Mr. Stewart, have you heard about an infection called HIV? No, this is an infection with a bug called HIV. Some patients, or most of the patients who are diagnosed of having your condition, are usually tested for this condition because they do exist together in most of the cases. For that reason, we will consider testing you for HIV, which will be discussed in further details later on during your management plan, during the discussion for your management plan. So this is the social history, past history, medication history. Then, for the medication history, how many questions do you have for the medication history, Dr. Marfadi?
Medication history, show me medication list. And for how long? Any complications, side effect?
No. This patient is not receiving any medication, so he doesn't have any medication list. What are the 3 questions for the medication?
Any illicit drugs over counter.
Thank you. Is illicit drugs an important part of your discussion?
Yes, most important.
So why didn't you ask about it? Because you did not write it down. Then we will come to the point of giving him treatments. The treatment here would be the 4 steps that we discussed for the management of the communicable disease. We will be going through them simply step by step, one by one. After that, I need to get to the closure, which is going to be the 7 points that we have discussed earlier. Agree?
Okay. Yes, doctor.
So this is what I'm going to write down in my paper. Whenever someone is refusing any kind of treatments or any procedure or any management, what are the steps that we do for any refusal?
Why?
How many steps? How many steps?
We have refusal. We have 5.
4.
Okay, why?
1 is why. If there is something you can offer help for, you will offer help. If there is nothing you can do about it, you will skip to the next step, which is the benefits of staying in the hospital, or the benefits of taking this medication, or the benefit of the decision that you have taken. If still not convinced, you will move on to the next one, which is the possible complications. And that's why it's important to mention from the very beginning that this is a potentially life-threatening. You will reuse this here again one more time. Then if he's still refusing, you will move on to the 4th step, which is involving the consultants. The usual pitfall is to involve the consultant right away from the very beginning without offering or doing any effort. The consultant, like any human being, he doesn't want to work. And he doesn't want to be involved in every single tiny matter in the world, because his senior house officer is incapable of dealing with that. Note that the examiner is your consultant and do not want to upset your examiner. So we will get to the consultant. The consultant will be in a better position to discuss that with the patients. Then what if he meets the consultant and still refusing? Will you allow him to go home? Simply speaking, to make this very easy, it depends on the condition. If the patient is going to harm only himself, or he is the only one who's going to have the consequences of his decision or his refusal, he will sign discharge against medical advice and a refusal form of treatment. If there is any third party harm, he can potentially harm others. Here, we cannot let him go because not only him that will be affected by this decision, but others also will be affected. So here, before leaving the hospital, I will ask for advice from
Legal team.
legal team. So the legal team will tell me to hold the patient or to keep him in the hospital or not. Forget the acts. Forget the law. You are not a lawyer. You are not a policeman. You cannot detain someone in the hospital against his will. Avoid struggle or avoid conflict with the surrogates. This is exactly what they are waiting for in this case. DAMA is discharge against medical advice. So this is the way to deal with any refusal. Regarding this patient, he's asking you for how long I'll be staying in the hospital. For how long, it will depend on his response to treatment. Some conditions, how long I'll be staying in the hospital? The answer to that is, I do not know, or I am not sure. What do I do when I do not know, Dr. Marfadi?
Positive, negative.
Appreciate the negative idea first, then the positive idea. So I appreciate how worried you are. I can only imagine how stressful that is for you, any form of appreciation. Then the negative idea that this is a very serious condition and the complications of which are potentially life-threatening. The positive idea that we will keep you in the hospital in order to get the best of treatments, keep you on follow-up because the response to treatment is variable among patients. So this is the diplomatic answer to be given to the surrogate. By doing so, I did not tell him about any duration, I did not give any time frames, and I did not put myself into trouble because I have no idea what type of TB does he have. We have cases of TB, we have cases of resistant TB, and we have super resistance TB. So nobody knows how he will respond to the treatment, and it will depend on his immune status overall. Agree?
Yes, doctor.
I want to smoke. I cannot stay in the hospital because I need to smoke. I appreciate your condition or appreciate your concern of any form. Smoking is very hazardous in your case, specifically for your case because of your infection. And I could strongly consider or advising you to stop smoking. The message should be very clear. Stop smoking. And I can offer you help by referring you to the smoking cessation clinic. I cannot stop smoking right away. I appreciate that this can be difficult in some patients, but by involving the smoking cessation clinic, they will come up with a possible idea or a proper way of helping you out to quit smoking or to deal with this problem at the time being during your admission. So I did not give any promises. I did not do anything.
Hello? Hello?
Yes, Dr. Marfadi, give me please 3 minutes and I'll be back. I have something urgent to fix. Just 3 minutes, I'll be back.
ড্রিল মেশিন দিয়ে ছিদ্র কর। बंदर शत्रु हैं?
What happened?
Is it finished? Okay.
Hello.
এই শুন, কালকে আমি ওই 5:30 বাজে উঠে আমি একটা জিনিস ধুতে হবে, বুঝছো? হ্যাঁ, প্রত্যেক দিন একই জামা একই প্যান্ট পরে যদি আমার নিচে থেকে লজ্জা লাগে, কিসে আবার কেউ সবাই কি
নাস্তা খেতে ভালো আছে,
খাওয়া হয়েছে আর বেশি খাওয়া শেষ?
টেস্ট আছে। হ্যাঁ,
কোথাও বেশি খাওয়া আছে? আমার হাত থেকে কে খাওয়া কথা? এই মিশলে শীতলে হাড়া ওকে একটা বালা জিনিস মানে দুনিয়ার না হয়তো আমাদের জিনিসই তৈরি
Okay, sorry for that. Let's carry on. Dr. Marfadi, تعالي.
Yes, Dr. Muhammad.
So, back to your case. We did discuss the issue of smoking. We did discuss the issue of refusing to stay in the hospital for whatever reason. Most common concerns regarding this case will be one about smoking, will be about the duration of admission, for how long, and about the kind of treatment that this patient will be receiving, and why each of the steps needed for the communicable disease to be discussed. Meaning, he will ask you, why are you going to admit me? Why are you going to isolate me? Why are you going to give me or to notify the authorities, and so on. Regarding notification of the authority, whenever something is related to the management of a communicable disease, notifying the local authority or the higher health authority, put it in that way, it's much easier. This will be an essential, critical, must-have step in the management of any communicable disease. Why? Simply speaking, again, because this is easily transmitted to every single member in the community who came in contact with this patient. Agree?
Yes, doctor.
So this is not considered as a part of breaching the confidentiality. Notifying a communicable disease to the local health authority or to the higher health authority or to the specialized health authority is not a breach of confidentiality. But
What
he doesn't
about when
want
he
any
has
his colleagues.
contact tracing?
He doesn't
Contact
want
tracing.
any of his colleagues or his contacts to come to know anything about his conditions or his condition. Simply speaking, the team who's going to be discussing that or to go for the contact tracing is not going to discuss any detail regarding your case with anyone without your permission. Simply
not allowed.
speaking, this team, who is not allowed?
The patient.
The patient doesn't have the right to accept that or to refuse it. Simply speaking, again, if he refuses the contact tracing, this is not his right, but still we will go with the 4 steps. Why are you refusing that? You will breach my confidentiality. No, you will not, because this team will be screening anyone who came in close contact to you to make sure that they did not catch the infection from you. But they will not tell any single detail about your case to whoever without your permission. No, I do not want that, but this will ensure that this disease is not going to be given or transmitted to others, and this will allow us to give them the proper prophylaxis and treatments. No, I do not want that to happen, but there are some serious complications if this does not happen, like having the infection spread among others, which can be potentially life-threatening to everyone. I will approve that. I will not approve that. I do not accept that. I appreciate your worries, and I will be addressing that in the next meeting with our consultant. He will be in a better position to discuss that with you. So I am ending the discussion at this point. I'm not fighting. I'm not arguing. I did try once, twice, 3 times, 4 times I failed. So at the very end, I did involve the consultant. Make sense?
Okay, doctor.
Okay, so these are regarding his conditions. What about admission or isolation at home? Will you allow this patient to be isolated at home? The simple answer is no. Why? Because isolation at home does not guarantee zero transmission of the infection to others. Plus, admission in the hospital, he's not going to stay in any room. He will be isolated, like you have mentioned, in a negative pressure room, which will not allow the spread of this infection to any or to someone else. Agree?
Yes, doctor.
On the run, we did mention something about visiting him. Nobody's going to be visiting me in the hospital. You can assure him that he can have visitors, but those visitors will not be allowed in direct contact with him. Instead, we will have some precautions before they get to visit you in order to prevent the transmission of the infection. What kind of precautions? This is airborne precautions, and no children allowed. Agree?
Yes, doctor. What about medication? Can I discuss with him side effect, type of medication, precaution?
Which type of medication will this patient be receiving? Is he going to receive the standard treatments for TB, or he has a super infection, or he has a resistant TB where you are going to add streptomycin, for example, or he is in a such critical condition in which you will add a tetracycline on the run along with amikacin. You're not sure about the exact treatment. It is not your job to decide it. This will be decided by the MDT after fully assessing the patient's case and his response to treatment. Agree?
Okay, what about direct observation therapy? We need to discuss.
Direct observation therapy. What does the direct observation therapy, the dot therapy means? Dot therapy means direct observational therapy. When someone, after being non-infectious to others, TB is either an open TB versus a case of TB. Open TB, he is infectious to others. Once he's infectious, he is for the 4 steps of the management of communicable diseases. After having smear negative sputum analysis, at least 2 samples, or he is receiving treatment for 3 weeks, which is closer, but he will never be allowed unless he is smear negative twice. If he's smear negative, he will be discharged home. and during or after being discharged, he will be on treatment. Unfortunately, this treatment is for an extended period of time. Some of the patients do not comply with the treatment, and they present with frequent exacerbations of their infections. For that reason, you will discuss why he is not compliant with his medications, and if needed, you will assign a nurse to visit this patient at a specific day during the week in order to give him the medications while she is observing him to make sure that he did take it. Agree?
Okay, doctor.
So this is what they mean by the direct observational therapy. So those are the concerns and those are the points regarding the discussion of this case. So whatever is applicable here is applicable for whatever communicable disease there is, and there is the outbreak of corona, and one of the dear doctors today told me that it is pandemic state now. Epidemic is on a national scale. Pandemic is an international scale. This is good news and bad news, because once it became pandemic, it means that every effort will be done in order to get rid of that infection or to find a solution for that. And hopefully it will be resolving soon with a vaccine or a treatment. Okay, so overall, thank you, Dr. Marfadi. Now the points to consider are clear. Overall, very well done. And the next time, I want it perfect.
Inshallah. Thank you, Dr.
Okay,
Muhammad.
thank you so much. Any question here, anyone? Dr. Marfadi, anyone?
Doctor, can I ask
Yes.
you a question? Like,
Sure.
in case of MRSA, do we need to notify first? And
No.
second, in case if the patient has, like a surrogate has an concern that my father or my mother got the infection in the hospital and getting angry, like how do we reply the concern?
So we are discussing MRSA now. This is another issue. You are asking the question, one, is MRSA a notifiable disease? The simple answer is no. Why? Because MRSA will not be transmitted as simple as other communicable diseases. Instead, for MRSA, we will take some precautions for whatever patients who's admitted and got a MRSA infection in the hospital. What are the precautions? One, this patient will be in a side room if possible. So he's not isolated, he's in a side room. Two, this patient should not be close to anyone with an open wound or with a catheter. Three, this patient will be the last in the dressing, the last patient on the ward to have the dressing done in order not to get the infection from him to the next patient. He will be the last one. And four, there will be strict hygienic measures in the hospital. And the nursing staff will have some precautions in the form of contact, which is barrier nursing. They will be having gloves, gowns, to make sure that they are not going to transmit this infection from this patient to others. Those are the precautions needed for any case of MRSA, but there is no notification and there is no isolation. One point here
how
to mention,
about
MRSA, can it be a local finding or can it be positive on the test and there is no clinical symptoms? The answer is yes. It can be presented in that way where you can get it as a positive result from the swab, but the patient does not have any clinical symptoms, meaning that the MRSA did not get into the bloodstream yet. Yes.
And doctor, how can we answer the concern that my mother or father got the infection from the bug and the hospital is responsible for it and the surrogate
Okay. You answer this question first. Let me reflect this back to you first. Do you think that MRSA is an error or a complication of the admission?
It's a complication, definitely.
So this is what I'm going to tell the patients or the surrogates. I'm sorry that you have such a terrible news today. I'm sorry to tell you that about your mother or about your mother's condition at the moment. However, this kind of infection is common in hospitals. And we are doing everything possible at the moment to minimize the risk of this infection and to prevent it from being transmitted to others. So I will follow almost the same steps for the error by having an urgent meeting, including the consultant in charge, the risk management team, infection control team, the head nurse, in order to discuss this topic and to take the necessary precautions and the actions needed to prevent this from being transmitted. What kind of precautions? 1, 2, 3, 4, 5.
But it's not an error, right?
It's not an error, no.
So why we are creating, and do we need to write an incident report also?
Did you hear me saying anything about an incident report? No. Simply, it's an urgent meeting in order to make sure that this problem in this part of the hospital is being processed properly to be put under control. It does not mean that this is an error. We do not want this infection in this ward or in this patient to be a problem in the entire hospital. So we will do precautions to prevent this from being transmitted to others.
Okay, doctor, thank you.
Hassan.
Okay,
Dr.
thank
Hassan,
you. Yes.
I have one case. What's refusal form? What does this mean, refusal form?
Refusal form if the patient is being offered any kind of a procedure or a treatment and he refuses this kind of treatment. So he will be refusing the treatment offered or the medical decision offered. And since he's refusing that, it means that if he is to be admitted, he is also refusing that. Usually they are signed together. So there is a refusal form along with discharge against medical advice. We advise him to stay in the hospital and take the treatment. He refused the treatment and he refused the admission.
Okay, Dr. Muhammad, just I have one question, please, regarding Matsa. Okay, how can to respond to the son if he said why ulcer already happened in the first place, or if he is concerned regarding
on the scenario.
Some negligence in nursing care, because
first of all,
supposed not to be happen.
Okay, I get your point, and let me check if I got that right. So first of all, we would agree on some points that we need to make sure that we do not fall for. One, I would never say that I do not or I do understand. Two, I would never say that I know. I will never understand how he feels, and I never know how this condition is affecting him. Three, I would never mention the word negligence whatsoever. I will either stick to being or to having an error versus a complication. No negligence. Negligence is bad reputation for doctors. You do not want that in your exam. And there is no sex or death. Simply, this is an intimate relationship and passing away. So those are the points to be known from the very beginning. Then, the scenario that you are talking about was about an old gentleman or an old lady, about 80s, and that gentleman was admitted in the hospital because he did suffer a stroke.
Yes, doctor.
Sorry for the interruption. Zoom is going nuts nowadays. I have no idea why. Can you hear me properly now?
Yes, doctor, we are hearing you.
Okay. So, regarding that case, he was an old gentleman who was admitted 1 week ago with a stroke. He is in coma and he is unable to move. And unfortunately, after 1 week, the gentleman showed sores or wounds on his heels, on his back, so it's a dependent area. So this is a bed sore. The question is that an error or a complication? What do you think?
Actually, maybe the surgeon respond if you have doctor good nursing care in your
forget the patient now. I'm talking to you. Is that an error or a complication? What do you think?
Complication, of course.
No, this is an error. Why? Simply speaking, always ask yourself, was that something that was supposed to happen or not? So, not possible.
Not to happen if there is a good nursing care.
Thank you. So it means that the team did not do its best. So the team did miss or forget or didn't do what it should have been done. So this is an error.
Okay.
Agree?
Yes, okay. So
Yeah,
I have
once-
to go through the. So just in this case, I have to go through this process of the medical error.
Of the error, exactly. So you will admit that error, you will apologize for that, you will tell him that that was unintentional, and then you're a professional team with high standards, and so on, with the incident reports, and the urgent meeting, and so on. So it will be an error. So this is the first point. Regarding the second point, case of Marsa. This case did present in Date 119. I guess it was in Egypt, as far as I can remember. So that case, is there any clinical infection of MRSA? It was mentioned clearly in the scenario, there was no clinical sign of MRSA. It was just isolated from the wound. Is that possible? Yes, and this is the most common presentation of MRSA. Is that going to be an issue? This is why we are taking the precautions in order to prevent it from being transmitted to others. Did I answer your questions?
Yes, correct.
Allah yaftah alik. Okay, any other question here?
Dr. Hassan, I have a question, but it's about another scenario.
Shoot.
It's about a patient who was known epileptic and he was given tramadol. And after that, his control of epilepsy was, he had an attack of seizure and he lost he's about to lose his driving license again. So here in this scenario, is it an error or it's this is a confusing scenario for me.
Okay, so the problem with this scenario is the inappropriate way in which it was written or have the feedback given to us after the exam, because it was not specified if the tramadol was given by the team or not. Simply speaking, if this patient presents with epilepsy, tramadol, generally speaking, has a lot of complications. Some of them are very common, some of them are very rare, but they are still complications. One of these complications is exacerbation of the epilepsy. However, this is very uncommon. So, if your consultant or the MDT has given this tramadol in the best interest of the patients, without telling him about the possible side effects, it's an error. But if this was given to the patients, knowing that he may suffer this complication, it is not an error. So it's all depending on the scenario, and that's why this is the problem. That's why it's confusing for a lot of us. It depends on what is written in the scenario. If this tramadol was given by the GB, it's an error. Why? The GB is not the specialized in this field. He's not specialist in that field. So it's an error. But if this tramadol was given by the neuro consultant, who is essentially my boss, who is essentially your examiner, I would never hold the consultant responsible. So I will try to justify that, depending on the scenario. Did he have a meeting with you? Did you have further investigations? How did you get proper assessments? Yes, yes, yes. Did he discuss that side effect with you? He has to say yes.
Okay. Actually, I heard that he had a knee surgery and it was given by the orthopedics doctor.
Thank you. So, orthopedics, prescribing a medication. This medication did precipitate a side effects. It's a side effect. But did they discuss the possibility of this medication on his condition? Did they take into consideration his epilepsy or not? Unlikely that they did not consider, or unlikely that they have considered the epilepsy as a contraindication for tramadol. If they did not consider it, it's an error.
Okay, all right.
So it's all depending on the scenario. Yeah.
Okay, thank you.
Thank you. Any other question here?
Dr. Muhammad, I forget to ask before, who's the doctor will do the tracing for TB?
Simply speaking, keep it simple. Who is going to do that tracing? It's a specialized team from the local or the specialized health authority. Go or give it to him as a higher health authority. or a specialized health authority or a special team or a specially skilled team in that part of problems who will be able to deal with this problem without giving details.
Excuse me, Dr. Mohammed. What about mistakes made by GP? Should we apologize and write incident report?
We did discuss that before. Let's take a look at the screen and let's agree that this patient is surrounded by medical members or medical team members who are taking care of him. And those include you as a senior house officer, your consultants, all the nurses in the ward, the lab technicians, the X-ray technician, and the GB, and everyone who's involved, the occupational health officer and the social worker. All of them have an access to this patient's file, to his information, and they are responsible to give him the best of treatments. When someone of them or one of them has made a mistake, it's an error. It's the responsibility of the entire team. So yes, if the GB has done an error, it will be treated as an error and you will go through the steps of the error. Why? Because the GB is essentially your colleague and he is part of the management team for this patient.
Okay.
Dr. Mohammed, how the higher authority will trace contact without breach of confidentiality?
Simply speaking, we had a report regarding one case in this place with this kind of disease. And that's why we need to screen everybody for it without specifying who has the condition or what was his presentation or anything about his condition. Someone here had this problem. That's why we need to test you all to give you the proper prophylaxis or the proper treatments.
Okay.
Make sense? Yes.
Dr. Ahmed, if the still refusal of the patient, you told
you will follow the same steps of the refusal.
Yes. If it is make harm for the patient himself, or if there is harm to the...
Let me do this simply with you, step by step. What if someone was diagnosed of having an MI and he was admitted and you have offered him a BCI? He refused the BCI and he wants to leave the hospital. You have done the 4 steps of refusal. He's still refusing after meeting the consultant. Will you allow him to go home?
Yes.
Yes. After discharge against medical advice, after he signs that, and he signs a refusal form. So when this patient is going outside and he collapses outside the door of the hospital and dies, I am not to be blamed.
Oh, yes.
Make sense?
Makes sense.
Example. The other example is someone with HIV. And this gentleman does not want to tell his spouse or his wife about his condition. Yes. Will you breach his confidentiality? Straightforward answer, no.
No.
I'm not going to breach his confidentiality. Never, ever say, yes, I will breach someone's confidentiality. No. But he will transmit the infection to his wife. So I will try to convince him on the next meeting involving the consultant. If he doesn't respond, I will seek advice from the legal team before taking any action. So when this gentleman goes to the court and tell them that he has breached my confidentiality, I will have the legal justification. If this is a case of a communicable disease, like open TB, HIV, or corona, if this patient is not willing to participate or to be complying with the admission, will you allow him to go home? No. I will try to convince him. How? The 4 steps of the refusal. If he's still refusing after meeting the consultant, again, it is the legal team. The team will tell me to detain him in the hospital. They will assign the security. They will do whatever. So when this patient goes outside and he complains that they have detained me in the hospital against my will, I have the legal justification.
So Hassan, and for HIV, we need to take consent for every patient.
For which, again, please, consent for what?
For HIV testing, like in the TB case.
Testing? Okay, you will tell him that he will be tested for HIV. Unlikely, in this case, to have any time to discuss the testing of the HIV, and it is not part of your management plan. So, since you are giving headlines about the treatment options, you will mention the possibility of being tested for HIV because this is most likely happening in his condition and other conditions like that.
Okay, thank you.
How long I will be admitted, Dr. Muhammad?
Do we have an answer to that? No, we do not have an answer to that. So when I do not know, I play the game of communication, which is very simple. I appreciate how worried you are, or I'm really sorry regarding the terrible news, or whatever form of appreciation. Then I will tell him the negative idea. The negative idea here that nobody knows what will happen in the future. And the response to treatment is variable among patients. The most important point here is that this is the positive idea that we will give you the best treatment, keeping you on close monitoring to make sure that you are receiving the best care and proper follow-up till you recover from this problem. So I did not give any time frames. I did not give any promises. Instead, I did give him the hard truth. So I did show sympathy. This is step one. And I gave him the hard truth. So there is no false hope in your feedback. And by giving him the positive idea, I did the reassurance. So the examiner cannot write down in my feedback that I did not reassure the patients. Make sense?
Dr. Muhammad, you asked the doctor, according to your experience, how long a patient like me admitted in the hospital?
Exactly. So this is a common trick by the surrogates. The surrogates, when you give the proper answer and not giving any time frame, he will try to trick you one more time or even 3 times by asking you repeatedly about the duration of admission. The duration of admission. I will stick to my answer. I do not know. I will give him the negative idea and the positive idea. Then with the examiner, I can discuss that. Most likely to going to be for at least 3 weeks or till smear negative. But this is to the examiner, not to the surrogates.
Dr. Muhammad, shall we counsel him about the possible side effects of the antituberculous therapy or not?
No. Why? Because I do not know which regime he will be started on. If it is mentioned in the scenario, you will discuss it with him. But if it's not mentioned, I'm not going to mention anything about it. Simply speaking, before initiation of your management plan, taking your medications, we will have another meeting to discuss those medications and what we need to know about them.
Okay, thank you.
Dr. Muhammad, recently,
Wait, because I have something irritating here. Root cause analysis. Please, do not irritate your examiner. Please, don't do it. Simply speaking, urgent meeting to discuss what happens and how to prevent it. Root cause analysis will open a door that you will not be able to shut down. And this is for quality management, for hospital quality management, not for the MRCP. So try to keep it to the point, because if the examiner is curious, you are in trouble. Yes. Sorry for your interruption. Carry on, doctor.
Sir, regarding isolation, so is it still in session to isolate the people with active TB in hospitals? Because recently they changed the guidelines and they say that no need to isolate each and every person of tuberculosis. The hospital.
Okay, I totally agree with that, but that should be mentioned in your scenario, and most likely in 100% of your case, in your exam, it is going to be for hospital admission. Why? If this patient is to go home and take the medications at home, there is no case. So what I'm going to be discussing with him, that he has TB and he will be given treatment at home? They have to bring you a scenario to test your refusal, how you would react to the refusal, and how you're going to convince the patient. Make sense?
Yeah. Thank you, sir.
Dr. Hassan, I didn't understand what you meant by not to mention root cause analysis still.
Root cause analysis. What does it mean? It means going through every step since this patient was admitted to identify what was the problem. Root cause analysis is a common term used in hospital management meetings. This is not a part of your MRCP exam. If the examiner starts to ask you questions about that, you will be in a lot of trouble. And if the examiner doesn't like it, you will be in a lot of trouble. So try to keep things simple. Root cause analysis is not done in every hospital. There is periodic assessment. There is individual cases assessment. So that is the urgent meeting that you are going to have. The problem is someone has been mentioning the root cause analysis every now and then, but he himself or she herself did not do that in her exam. I have done errors twice before in my exam attempts, and I got the full mark without mentioning anything about root cause analysis. Keep it simple. And when someone is offering you something, ask him, did you do it in your exam or not?
Okay, thank you.
Thank you.
So what to mention instead of root cause analysis?
Error. Simply admit the error. Apologize for that. We can have a case of an error tomorrow if you wish to. Then you will tell him that was unintentional. Then you will tell him that you are a competent medical team, a professional team with high standards. However, mistakes do happen even in the best hands. And for that reason, you're going to write down an incident report, and you're going to have an urgent meeting, including 1, 2, 3, 4 members. Most important member is going to be the risk management team. And eventually, you are going to apologize again for this patient. So standard 6 points for any error. Each point of them is serving a certain purpose, and each point of them is to cover one concern by the patients. Do you want to know them? Are you still there? The doctor did ask the question.
Yes, sir.
Dr. Annie, what if I tell you that you have given my mother a medication by mistake and I have lost faith in all of the medical team? How would you respond to that?
Okay, so I appreciate your concern, and I apologize that it was given unintentionally and it was a mistake. We are a highly professional team of doctors, and mistakes.
This is the point here. So this point is serving that purpose, because if we did something wrong, it does not mean that we are bad. Bad or errors do happen even in the best teams. So we are not a bad team. So this is the answer to, I have lost faith in you guys. How do you want me to believe you anymore? And this is a very common concern. So this is serving a purpose. The incident report is going to be the legal issue, serving a purpose. The urgent meeting, what did you do about it and how you're going to prevent this from happening again in the future? This is what I'm going to do to prevent it again in the future. Starting with an apology, ending with an apology, to absorb his anger and to calm him down. And mentioning that that was unintentional, to make things a little bit easy during the discussion. So every point of those is serving a purpose. Root cause analysis is not serving any of those.
Okay.
Hopefully this is clear. We can have an error tomorrow discussion regarding that to see what are the more important points rather than not only those points, other points also to consider. So it was a good discussion. Thanks everybody. And I'll be seeing you tomorrow. If you have cases for me, send it to the Telegram or the WhatsApp and we'll be discussing that tomorrow. Thank you everybody. And